Hi, friends. This month, being a National Skin Awareness Month, I have called an esteemed dermatologist who has been or who has done a podcast with me earlier. Here's Dr. Nisha Chaturvedi. Hi, Nisha. How are you?
Hi, Hemal. I'm fine. Thank you for
Good.
having me here again.
Again, yes. That was fun. We are in Portugal and we are making 10 people wait in the bus, not 10, 40 people waiting in the bus,
Yeah.
and we are doing a nice podcast. Anyways, uh, that time we covered few things, but this time I wanted to know that as a basic human being who's going to work every day and a natural day-to-day life, what skincare does a person take? Is there any difference between Indian climate and a Western climate? So what they are doing in Western countries, are we supposed to do the same thing? Or what extra care as an Indian layman should take every day-to-day basis?
So, Hemal, that's a excellent question actually. And what I believe is for your skin health, it needs to
Mm-hmm.
be simple. It
Okay.
does not need to be complicated. It has to be something which one can follow consistently because consistency is the key,
Okay.
right? So, first, I'm going to answer to your first question as to what should be the skincare routine like.
Okay.
Uh, Morning and night, right? So in the morning, simple face wash with a
Okay.
gentle cleanser,
Okay.
followed by a moisturizer
Okay.
for your skin barrier,
Okay.
and followed by a sunscreen, which is protection from the sunlight. That if these three basic steps are done in the morning, you are good to go.
So that is one, two, three. If I have to say again, what is it? Face wash,
Face wash, moisturizer, sunscreen.
sunscreen. Perfect.
That's it.
Okay.
Simple. And in the evening, again, face wash, your moisturizer,
Okay.
and one of your actives. By actives, I mean either
Okay.
an anti aging cream that you're putting, or if
Okay.
you have acne, then you're putting acid,
Okay.
like your anti acne cream you're putting.
Okay.
So, depending on what you are, what your skin condition is, but that's the basic.
Okay. But as I asked that, any difference between Western countries and Indian countries to take care?
Yeah. So again, coming to that question, our country, of course, I'm going to talk more about Mumbai because
Okay.
we live in a humid environment, right?
Okay.
So things change here, correct? Uh, we are prone to a lot of acne. There is a lot of pollution around us,
Mm-hmm.
okay? So there is more damage to our skin. There
Okay.
is more pigmentation that we are prone to. We are prone to
Mm-hmm.
more tanning.
Okay.
So these are the things that we are more prone to here.
Acha.
So, like I explained, accordingly one needs to tackle.
Mm-hmm. So, what is the biggest mistake a person or makes in skincare? Like, you come across some patient doing, means I have heard in our practice when a person gets burned, they put toothpaste on, or a tuna. They feel that putting tuna or a toothpaste on a burnt area is good. What is some kind of a mistake which a routine person does, and you would like to highlight that?
So, actually, it varies a lot. But the
Mm-hmm.
biggest mistake I think people make these days is thinking that if I am indoor or if I'm not stepping out, sunscreen is not important.
Okay.
Second biggest mistake I have seen people is following these skin trends, okay,
Like.
which is just trends of having glassy skin.
Okay.
We are not that skin type. We are genetically different.
Okay.
So certain trends like that, certain trends like lathering yourself with Vaseline, right?
Mm-hmm.
So, but we are in a humid environment, so that can give us more acne. So
Okay.
these trends which people follow, it may not be suitable for you.
So you feel there's a difference between, like, someone says, "Oh, my skin is very oily. You should do use this type of." So is there a difference between a dry skin, oily skin, or anything to apply for?
Absolutely. So people with dry skin will need more hydration, will
Okay.
need more moisturizing, right?
Okay. Okay.
Will need more gentle cleansers.
Okay.
People with oily skin, acne prone skin, they
Mm-hmm.
could use face washes which has more of salicylic acid, more
Okay.
of glycolic acid. So
Acha.
those can be used by them. Again, people with oily skin, then you don't want to give them very heavy moisturizers also, right?
Mm-hmm.
So it changes according to the skin type.
Okay. And since we're talking about changes according to the skin type, are there any changes during the change of the seasons, like summer season, monsoon, winter? Do you change your whatever the product you have?
Yes.
You change according to the seasons also?
Absolutely. Every product gets changed according to the season. Monsoons and summers, like I explained, it's hot and humid, right? So we are more prone for getting acne. Fungal infections are quite common during monsoons. So what happens is that in monsoons, we tell people to apply more of, and in summers also, apply more of cleansers and moisturizers, basically. Moisturizers which are lighter. Okay. When it goes to winter, we tell them to use more of cream based.
Oh, yes.
Right? In summers, we can tell them to use more of gel based or more of water based. So there is a difference there in the kind of products that you use.
Yeah, I remember my mom putting Vaseline in winter on my lips when we were going to school. So all those, that's what you're trying to say basically. In winters, it's more of such kind of products you apply on the face?
Yeah, in winters, you apply much more heavier moisturizers. But again, like I said, depends on the skin type. Right? If your skin type is dry, then you may use a little more heavier moisturizer.
Okay. As a male, I am not used to all these skin products and all, but yes, always, what does SPF mean? I don't understand that SPF and what specific SPF a person should know. Does the SPF changes again with the seasons or SPF remains the same?
Okay. So SPF is basically a sun protection factor.
Okay.
But it measures your protection against your UVB.
Okay.
Sunlight has a spectrum, your UV, right? UVA, UVB, UVC. SPF tells us about protection against UVB. Okay. So anything more than 30 plus is okay. But that's not the only factor one should look for.
Okay.
If one looks at the sunscreen, there is something called as PA. So it's PA+++, which tells you protection against a UVA light. Okay. So that is also important. So if it has a SPF of 30, PA protection plus, and if the sunscreen says that it protects against visible light, blue light, which means it's a broad spectrum sunscreen. Right?
Oh, okay.
And that's the one that
people should use. Yeah. A broad spectrum.
A broad spectrum sunscreen.
So basically, you have to use a broad spectrum sunscreen. But does these things have written like this? Because I'm hearing it for the first time. The PA part, I'm hearing it for the first time. It was always SPF 30, 45 or blah, 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 whatever.
No, they have written.
They have written. Perfect.
If you pick up a sunscreen, they would say SPF 15, 30, 50, 80, PA+++++++, protection against...
Sorry, please.
Protection against visible light, blue light. Now we have sunscreens which are tinted, which has a little bit of ferrous oxide in it.
Now that brings to me another question that fine, we are using these products and all those things. How naturally can we take care about your skin as regards to your diet, day-to-day activities, nutrition? How can you improve your skincare without spending money?
I never say skin care in that sense. It's always about your skin health.
Yes, right? True.
And that's where, so your routine, what you eat, okay. Having a lot of, I have to tell all my non-vegetarian friends, please don't focus only on your chicken, please make sure you eat all your veggies and fruits along with it, right? Because that's the fad, right? Increase protein, but actually your antioxidants are there in your veggies and your fruits. So that's very important, right? Then omega-3, B12, making sure your vitamin D3 is at a level. So all that is very important.
Okay. So, how about drinking water? Does drinking more water, less water, what helps?
So drinking water is generally good for your health.
Okay.
Right?
But does it stop giving you acne or something like that?
No. So drinking water doesn't make your skin hydrated. Applying your moisturizer is equally important. Okay. So if you say you have a dry skin and I'm going to have 8 glasses of water and my skin is going to get hydrated, no.
That's not right.
You have to put your moisturizer.
Perfect. How effective is glutathione?
Okay, so glutathione is an antioxidant.
Okay.
It has a role at a cellular level.
Okay.
It helps in a lot of redox mechanisms. It helps. It has melanogenic properties.
Okay.
So it, of course, it actually lightens your skin.
Okay.
But it's been promoted as a skin lightening agent.
Okay.
So what happens is, people use glutathione orally, and say now sublingual forms are available. To a certain extent, that's okay. But the IV glutathione, which now is available at a lot
Left,
of
right, and
salons,
center, yes.
yeah, and people have been practicing that left, right,
Yes.
and center, like you said, the gluta shots, all of that. So there is no FDA approval for that.
Okay.
Secondly, the amount of side effects with the IV glutathione, and it's are not monitored. There have been reports of hypotension, electrolyte imbalances, anaphylaxis reactions. So IV glutathione is not recommended at all.
Okay.
And according to me, it should be totally discontinued.
Oh, so you don't believe in giving glutathione?
I don't believe in IV glutathione.
Okay.
I have given patients oral glutathione or sublingual when they asked for. But what needs to be understood about glutathione is you can't use it like a skin lightening agent, in the sense that it will lighten your skin because it has those properties.
Okay.
But once you stop, you're going to get back your natural color.
That was exactly that was exactly my next question was, is there an end point? And if there's an end point, do we come back what we were? If you are not giving glutathione, okay, they will go to someone else and take it, because they have been so much kind of under the what you call brainwashed probably by the people around that glutathione is very good, you should take it, because along with glutathione they give you multivitamin injections and then some acetylcysteine or something they give which helps with glutathione and all. So you really don't advocate, and you don't...
I don't advocate IV glutathione at all.
Superb.
What I tell all my patients are the facts, except the color, the whole fairness gimmick and the whole fairness thing that you have in your head, you know. So you try and counsel the patients to accept the color that they have. You tell them about good skincare routine, protection from sunlight, which reduces the pigmentation. You counsel them about these side effects with IV glutathione. It's not regulated.
True.
You know. So once you actually tell the patient about the facts, and actually now social media has also done so much of this work.
Yes, true.
With the cases and episodes that we hear with IV glutathione now coming up, I think people are now in fact getting more and more educated of not doing things, which I'm pretty happy about.
Good. That is nice, because no pains, no gains, and if to what I understand, the way you're talking, you can get the same results by taking good skin care and abusing yourself with glutathione.
Same results is an extreme, but but at the end of the day, once you stop any of this, you're going to get your
skin
back. So I think this whole madness about fairness, of wanting to become fair and wanting to become a certain celebrity skin type, I think that everyone's genetics play a role.
So Nisha, let me ask you about the lifestyle, diet and our environmental factors. So how much does a diet affect our skin health?
Correct. So a good healthy diet obviously will affect your skin health. Eating a lot of fruits, vegetables, which has a lot of antioxidants and all, help in improving your skin, hair, nail. Having said that, now we have seen that food with high glycemic index, right, which has a lot of sugar, can trigger acne. Secondly, even food with a lot of milk and milk products, right, there are research papers and studies which show that they trigger changes in your hormones and stimulate insulin-like growth factor, and they give rise to acne. So when it comes to acne and food, we generally don't tell, it's not like a blanket statement that don't have anything, but sometimes we tell them to avoid milk and milk products, excessive, and food with high glycemic index, like your sugary food.
So Dr. Nisha, tell me, what is your routine? What do you do to take care of your skin?
So for my skin health, morning I wash my face, I apply a moisturizer,
Okay.
and I wear a sunscreen.
Okay.
I keep it very, very simple.
Nice.
And night again, I wash my face, I apply a moisturizer, and some days I use retinol.
Okay.
Cream, which is an anti-aging.
Yeah, anti-aging. Or I've seen people giving retinol for these acnes also.
Yeah. So basically, they are all retinoids.
Okay.
For acne, we give a different type of retinoid,
Acha.
which is there are groups, categories.
Okay.
Right. So your retinol, which is used as anti-aging. All retinoids will become anti-aging because they all have that property, right?
Okay.
But some of them work for your acne and work more on they have anti-seborrheic properties. So they reduce your secretions of your seborrheic glands and all of that also. So tretinoin and adapalene, which are the two commonly used for your acne. And actually, you would be surprised, some retinoids are also used for skin conditions like psoriasis and all.
Oh, wow.
Because they help in keratinization. Right? Regulate retinoid. One of the property of retinoid is to regulate keratinization.
Achha. So, Nisha, I just would like to know, what are the red flags, or probably how often should I see if I feel nothing is wrong with me, but still, how we do health checkup, do you think that there has to be a routine health checkup with a dermatologist, or how often should I visit a dermatologist?
So, Hemal, I think if you're okay with your skin health and everything is going great, then once or twice in a year, you must visit your dermatologist in this country.
Okay.
Of course, people abroad who are more prone for melanoma, they should visit more often and get their moles checked. Right?
So, are there any, since you mentioned about the moles, or what we call it as melanomas, and which could be benign or malignant or something like that, anything striking somewhere on the skin which, like a papilloma turning into malignancy, or a skin, I know it's a totally different ball game altogether, but really a red flag that something happens suddenly to your skin, which then you should visit a dermatologist?
So if you're talking just about the moles, right, which are your nevis, still, you must keep a little check on that. Luckily, Indians are not prone for melanoma. The skin type is not prone. Skin type 1 and 2 are more prone for getting them. But important factors here when you do your mole check are if you see any change in the color of your mole. Any change in the color of your mole, any change in the shape of your mole. Right? If suddenly you are feeling textural changes, suddenly you feel that your mole has become much bigger in size, or you're feeling any surface changes, or if your mole becomes symptomatic, if it becomes itchy, if it becomes red, please consult and get your mole checked.
All right. Thank you, Nisha. Thank you so much. So thank you, Nisha. Thank you so much. It was really a great pleasure. And I hope, and if any questions audience have, please do write, or you can consult Dr. Nisha. She's practicing in Andheri area. And thank you so much. If you just want to give some one-liner take-home message to my viewers.
So thank you, Hemal. I really enjoyed again our little podcast that we had right now, and I'm sure our viewers are going to benefit from that.
Hope so.
But I would also like to conclude by saying that please don't follow all these skin trends which you all see on social media. It does more harm than good. And for any of your skin, hair, nail related issue, please consult a dermatologist. Thank you.